Hi guys, Dr. Sammy Gibson here with Eastwood Animal Clinic, and today we're going to talk about Parvo. Parvo is a virus. It is very prevalent here in El Paso, in this community in the Southwest, and we'll probably never get rid of it. Just like any disease, it all depends on the geographical area that you're in. You are predisposed to different issues depending on where you're from. So up north, they have Lyme disease, more ticks. Other areas, they're dealing with more snake bites. They're dealing with all kinds of things. Here, Parvo and distemper are two big ones. What is Parvo? Parvo is a virus that gets in the GI system. They get exposed to it through a fecal-oral route, which means somewhere along the way the patient licked poop, sniffed it, did something along those lines, and somehow ingested the virus. Typically, when they ingest it, you don't know that. The clinical signs will show up about 10 to 14 days after the patient's been exposed. So once you're starting to see anorexia, lethargy, vomiting, diarrhea, those are the big red flags for young dogs that are unvaccinated or have not completed their vaccine protocol. And those are the big red flags that most veterinarians will kind of look for in this area, and that'll be on our list. So Parvo, once again, it's a virus that they get exposed to in the GI tract, and anorexia and lethargia are your two first changes that we commonly see. So they will stop eating and drinking, peeing, pooping, and acting like a puppy. The good news with Parvo is the vast majority of patients, when treated, we do really well with. Do not get me wrong, Parvo is one of our biggest puppy killers here in El Paso. It does kill puppies and young dogs. It absolutely will. But it at least responds really well. And every clinic has their own little protocol with it. There's a few variations. Hospitalization's usually a big one. Counterstay in the fluids is, or in treatment, sorry. The mainstay cornerstone in treatment is fluids. Regardless what you do, at all the different clinics I've worked at, the mainstay is fluids. Everybody uses a different antibiotic. The antibiotics don't seem to matter too much. But you do need an antibiotic. It just doesn't seem to matter which specific one. Fluids are the key. Once again, the best way to go about it is hospitalization. Every dog is different. Parvo is a little bit of a roller coaster. Some days you'll have good days, some days you'll have bad days, sometimes it'll go in between and you'll go from one extreme to the other. The other route is what's called outpatient. So when you bring the patient into the clinic, the veterinarian will assist, the technician will do their thing, and usually the doctor will come up with a plan, typically something called sub-Q fluids, their choice of an antibiotic. A lot of doctors will use anti-emetics, which are fancy words for anti-vomiting medications. And, just touch base, and usually you'll follow up every day with the outpatient. And just touch base with your veterinarian. They'll walk you through it. Most of us in El Paso are very, very comfortable with it because we see it on a regular basis all throughout the year. It's worse at certain times of the year, but those are the main things to look out for, guys. So once again, just a brief recap on Parvo. It is a virus. They get exposed to it. It goes in the GI tract. And overall, we have a pretty good success rate when treated. It does kill a lot of puppies. And just stay on top of your vaccines and everything. And any questions, just follow up with your veterinarian. Hope it helps you out, guys. Bye.